Okay. Hello, my name is Alessandra Jimenez, and for my chemistry and careers interview, I have a dentist here with me today. Would you like to introduce yourself?
Sure. Hi, my name is Stella Tam. I am a dentist at a community clinic in Cutler Rossi. I've been practicing for about 10 years now. For undergrad degree, I majored in integrative biology, and then I took a little break, and then I went into dental school for 4 years. Mhm.
Okay, perfect. So I'll be starting off with the four general questions. My
Sure.
first question for you is what aspects of dentistry appeal to you as a student, and what aspects of your job do you enjoy now as a dentist?
So I knew I wanted to be in healthcare. I like taking care of people. But I think the best part of being a dentist is that you have to solve problems all day, and it varies from like basic stuff to stuff that requires a little bit more thinking, and it always keeps you thinking and on your toes. It's not boring.
Okay, that's good. And my second question is what kind of extracurricular activities or volunteer work did you do, or would you recommend that would help your dental school application?
So I was a dental assistant from age 15 up to when I applied, and I was always an assistant, whether in a working office or as a volunteer. And I think that really helps because it gives you the background so that when you're in dental school, you just focus on learning the other stuff instead of learning everything, all the basics, So you already know the basics going in, and that really, really helps.
Yeah, okay, that's good.
Mhm.
And my third question is what is something you wish you knew about dental school or the profession that you wish you knew before applying? And is there any advice about your dental school experience you can share to pre-dental students?
So the only thing that I wish I knew was how physically tiring dentistry is. And you may not think it is because you're sitting all day, right? But the ergonomics is really important. The way we hold our instruments, the way our neck is angled, it actually plays a big role in how you feel at the end of the day. And I wish I knew that. So when you guys start your career in dentistry, focus on ergonomics from the beginning so you learn the good habits first. And what was your second question?
And is there any advice about your dental school experience that you can share to pre-dental school students?
The first 2 years were really science heavy, so learn everything now, and so it'll be easier later, right? But just remember, it's all gonna pass. You eventually get through it, and once you hit clinicals, it gets a lot easier, a lot more enjoyable.
Okay.
Yeah.
And my fourth question is, do you complete a residency or specialties after dental school?
I did not. I went straight to work. I kind of had to work, but I
Mhm.
wish I did. I wanted to specialize, but you could actually still, work a couple years and then go back to school, and that's totally okay. And some schools even like to see that you have working experience before you choose a specialty. I
Okay.
personally did not go that route. I just went straight to work.
Okay. Yeah, and my follow-up question was, if you did not, would you wish you would have?
Yeah, I wish I did specialize, but now that we have kids in the background, it's really hard to go back to school with the family, but it would have been fun to specialize at some point.
Okay. What would you have specialized in?
Probably peds or perio, one of those two.
Okay, okay, okay.
Yeah.
That's good. Okay, so now we're going to be going into the science questions. My
Okay,
first
sure.
one is how does a strong background in biology contribute to the success of dental school? And were there any additional courses of biology that you took in undergrad that you can say better prepared you for dental school?
So dental school for my school, the first 2 years, like I said, was very science heavy. We share classes with the medical students, so like the first half of the day was all science classes and then classes after like in the PM. So to better prepare yourself, and it's actually a prerequisite. You have to take like the basic science classes like biology, anatomy, physiology, biochem, microbiology, all those. But specifically, I think anatomy would really, really help for dental school. That was pretty challenging for me. Mhm.
Oh, okay. And how does a strong background in biology contribute to the patient care you provide now? This can be in aspects of diagnosis or treatment of a patient.
So when you're um like strong in your science background, when you see your patients, the medications they're taking, then you kind of know, okay, I'm expecting they have this kind of certain condition,
Mm.
and what that condition is and how that can affect your treatment. Like, for example, heart patients or cardiac patients, do they need pre-meds or do they need a different kind of anesthetic? Or like dialysis patients, we have to do treatment on the day that they don't have dialysis, that kind of thing.
Oh, okay, okay.
Mhm.
And my third question is, how do dentists stay up to date with the latest scientific evidence in the field? And has there been any recent evidence that you have implemented in your practice?
So every 2 years we have to renew our license and we take continuing education classes, and that's like considered like updates in dentistry, whether it's a pharmacology class or like materials, techniques updated. So for example, there are certain materials that we use daily that are improved. So that's why we keep using them versus back in the day, certain materials are not as good or they don't last as long. So every couple years, new materials come out, better research comes out, and that changes what we turn to in terms of what materials we like to use for patients.
Okay.
Mhm.
Okay. And the fourth question is, are there emerging areas of research in dentistry you believe can make breakthroughs in the field? And is there any that you would want to implement in your practice?
So in the implant field, there's always so many different changes and different studies coming out. And it's really interesting to see that every couple years the implant design changes, whether you're talking about like a longer implant or like a tiny, tiny little implant, what kind of materials, the design, whether the threading plays a role, the coating of the implant. Um, Unfortunately, at the time where I work, we don't have implants offer. We don't offer implants, but I think it's interesting to see how down the road, it becomes more widely available and more easily accessible. Mhm.
Okay. Okay, so now we're going to be going into the chemistry questions.
Okay.
My first one is, how does a strong background in chemistry contribute to the success of dental school?
I think any science class will help in dental school just because there's only like the first 2 years is very science heavy, and chemistry probably will help you in pharmacology too, just
Um,
understanding what's going on.
Okay.
Mhm.
And my second question is, what role does chemistry play in understanding drug interactions and dosages of medications, such as for pain or antibiotics in the patients you prescribe them to?
So for me, chemistry just reminds me of pharmacology, and that's going to help you figure out, like, for example, in acute stages of infection versus chronic stages, the medication choice is different. And you would have to understand what kind of environment is that infection. Is it like it's probably going to be like um anaerobic, right? So
Mhm.
it changes what we choose. Or for example, an infection, the pH is lower, so we know that, okay, certain anesthetic may not be as effective. We have to wait until the infection goes away, then the anesthetic will kick in. Mm.
Okay. Oh, and my third question is, what is the role of pH in oral health, and how do dentists use this knowledge to develop effective treatments for your patients?
So pH, we know that when the mouth is more acidic, the demineralization of the teeth happens more frequently, more fast, more rapid. So when we're looking at a patient, we try to encourage them to keep that pH at a more basic level.
Mhm.
Um, and so, for example, we would avoid acidic foods, drinking coffee, that kind of thing. And we know that when we eat a lot of certain foods, like carb-heavy foods, the bacteria in our mouth love to eat that too. So then the byproducts from these carcinogenic bacteria drops your pH. So we try to focus on teaching oral hygiene habits where we want to bring up that pH so that's not as acidic, encourage use of fluorides to help remineralization, or specifically like for geriatric patients, who have dry mouth. Dry mouth means like they don't have a lot of saliva, and without the saliva to help remineralize, they tend to get cavities more. So with those patients, we recommend dry mouth products, or we choose filling materials that release fluoride to help remineralize.
Okay,
Yeah.
very interesting. Okay, my last question is, what are the key chemical properties of dental materials such like amalgam and composite resins, and how do these properties affect your choice of material for treatment of a patient?
So for any field in the body, like we focus on the material being biocompatible, being stable, being safe, especially if it's going to be in your mouth all the time, right? So the most of the things that we come up with on or in the market are safe and stable. But specifically, like for little kids who have a lot of cavities, or like I said, the older patients that tend to get a lot of cavities around their the cervical area of the teeth, we look for materials that release fluoride. I know there's a lot of controversy around fluoride, but it really is a good material, good ingredient in dental materials because it helps remineralize and strengthen the teeth, which is ultimately what we want, right? Why would we not want healthy teeth, right?
Yeah.
Yeah. Mhm.
Okay, okay. So those were my last question. That was my last question.
Okay.
So thank you so much for being able to do this project with me and taking time out
Um,
of your busy day,
no,
okay?
no, no. Anytime, Alec. Come find me anytime.
Of course. Thank you so much.
Thank you. Take care.
Thank you.